My presentation today is going to be on the stethoscope and its basic overview. So the main topics that we are going to cover today include what the stethoscope is used for, the parts of a stethoscope, and how a stethoscope works. So the first question that we need to cover today is what exactly is a stethoscope? Now, most of us have probably been to a doctor at some point in our lives, and we've all seen every doctor wearing one of these around their necks and probably had them use it on us. Generally, they'll be using them to check stuff like your chest or your back, just listening to your heart or your lungs, and what it's doing is allowing them to listen to your internal organs. So the first thing we need to cover is the parts of a stethoscope so that you know exactly what it is comprised of and how they'll work together. So the stethoscope is made up into two main components, the headset and the chest piece. The headset is comprised of two earpieces at the top, connected to a hollow metal tube that then connects directly into some rubber tubing. The chest piece is made up of the stem, the diaphragm, and the bell. The diaphragm is the larger circular metal end that allows the doctor to listen to a wider area of the patient's body. The bell is the smaller circular end, which allows them to listen to smaller areas. The diaphragm can detect higher frequency sounds, while the bell detects those that have lower frequencies. The bell and diaphragm connect together to a metal piece called the stem. This metal-ended stem then connects into the rubber tubing, allowing for the noise caught by the diaphragm and bell to be sent upwards towards the earpieces. Now, how exactly does the sound go from your body into the earpieces? So the sound waves that are occurring at your body at all times are able to be captured when the diaphragm or bell is placed onto your skin. This is because the concave shape allows for the diaphragm or bell to completely seal off one area of your skin. By doing this, any sound waves that travel up will be captured by this concave shape, and they will go and vibrate the metal very slightly, allowing this to travel up the stem into the metal or into the rubber tubing, which allows it to actually amplify this vibration because the air that's sealed inside that rubber tubing allows for the particles and the sound waves to become greater, leading up into your earpieces, which then allows the doctor to be able to hear what's going on inside of your body at a much louder sound than if they were just to place their head directly against your chest or your back. And overall, that's a brief overview of the parts as well as how exactly a stethoscope works so that you will be able to know using it in the workplace.